Over the last few months, Wake County has transitioned behavioral health services to community providers, including UNC Healthcare. Today, we are joined by Assistant to the County Manager, Denise Foreman, and WakeBrook Director of Operations, Paula to talk about the new program. Thank you both for being here.
Thank you for having us.
Denise, first, why has the county transitioned its behavioral health services to community partners?
Right. Mental health has been changing in the state of North Carolina for over 10 years, and the latest round of changes requires that counties can't provide service and manage the funding of services. So we had to get out of the business of providing services. We've got over 3,000 clients that we were providing care for in mental health or developmental disabilities and substance abuse. And we have worked with a group of stakeholders for over a year to transition them safely and effectively over to private providers.
And this transition includes a competitive bidding process. What has been some of the criteria used to select these providers?
Right. What we heard from our stakeholders is it was very important that that the transition for these clients go as smoothly as possible. It was important that we take our time and be deliberate. So we went through a competitive process to make sure that we could find providers that could deliver the quality of care and the types of care that our clients were accustomed to receiving from Wake County. And so I think although the transition has certainly been difficult and one that required a lot of effort and planning, I think the outcomes are going to be very exciting for the community. We have brought in fantastic private providers that are new to the community, that are doing very progressive and exciting things. The linkages that Alliance Behavioral Health Care is going to be able to bring for the entire region, it won't be just of Wake County, it's Wake, Durham, Cumberland, and Johnston. So I think linking the services is going to be very exciting for our community. And then some of the fantastic things that UNC Healthcare is bringing to the table will help challenge some of our providers. Some of the status quo that we've lived with, I think, will be pushed to the next level so that we can provide even better care. And they're doing some fantastic things at WakeBrook that I think will be a model.
It really is going to be a very, very exciting time. What we're doing at WakeBrook is something that really is very unique and novel within mental health. We're using more of a medical model where patients, typically when you go to a psychiatric hospital, you may stay for 2 or 3 weeks in one unit. With our integrated campus, we're going to be able to move patients quickly through the system, getting them to the lower level of care that they may need. Thinking about an ICU or a hospital, when you go to the ICU, you're only there till you're stabilized, then you step down to a step-down unit or intermediate care. We're going to use that same philosophy at WakeBrook so that we'll be able to use the beds and maximize the resources for all of our patients.
Paula, can you tell us about the phased transition of services at WakeBrook?
Back in October 2012, the Wake County Commissioners did approve for UNC to come in and operate WakeBrook facilities. Since then, we've had a transition of 4 programs. We've opened up our crisis and assessment program, our facility-based crisis program, our inpatient psychiatric program there. And then we've also opened up an addictions treatment program. So it's all been going very well.
What were some of the issues that county staff as well as the partners knew that you had to tackle in order to get to where we are today?
Sure, there were a number of them, and one of the biggest has been communication. As I mentioned, we have over 3,000 clients that were impacted by these changes, and varying levels of care on their own. Some of them are in group homes, some of them are in care of guardians, and so communicating with these clients to get them the information, to let them know about the changes that were coming and the providers and how to make appointments was a significant challenge that we spent a lot of time and effort trying to overcome. And there's been a few glitches. It hasn't worked seamlessly for everyone, but we've worked very hard to make it as smooth as possible. And then the others that we learned and anticipated were accessibility. So Wake County is a large county, and to help clients get to the services they need with a new provider was one that was important that we heard from our stakeholders, and one that I think that we've been able to accomplish successfully.
And what are some of the plans for WakeBrook's future? Obviously, it looks bright.
It is very bright. The exciting thing about WakeBrook is that we've got a campus that we can really integrate and provide a high level of services for our patients in one location. And the beauty of this is that patients will not have to leave to get the services they need. We can match the service with the patient's need. We also are stepping up both the medical care for patients and expanding our psychiatric services so that we'll have a more holistic approach. We right now have the ability to do radiology on campus as well as laboratory, and those things are new to the program, so we're very excited about that. We're also working very closely with the county jails. We want to focus on getting those patients, the young adults, out of the correctional facility and into mental health, especially those that have psychotic issues that are in the jails. And we're also partnering with our advanced paramedics to really focus on diverting patients outside of our emergency departments into the proper system. So we're very excited about all the services that we're going to be able to provide there.
And finally, Denise, how can citizens find out more about services that are provided?
Right. Alliance Behavioral Healthcare has helped us manage this entire transition, and they are available 24 hours a day, 365 days a year. They have a 1-800 number, 1-800-510-9132. They can answer questions for existing clients that may be looking for their new provider, and they can also help family and new clients get connected with a new provider.
Well, Denise, Paula, thank you so much for taking time out to talk about this unique program.
Thank you.
Thank you.